The MaxWell CARE program is a very different kind of program than what people are used to in going to see their clinician. It's a very tailored individual type of program where we are looking at the patient in a very holistic manner and really looking for the root causes of the issues that they're dealing with. We have a lot of different tools that we're using, and so it's very different than what people are used to in a conventional medicine model. With the MaxWell CARE program, you're actually being seen very regularly in the first 3 months. We have extended visits, which are about 90 minutes each during those first 3 months, and so there's a lot of detail on the first visit with your history, and the second visit is mostly going over the findings that we have tested and all of your test results that are quite extensive. And so we're looking for reasons for the problems that you're having, the underlying root cause, and then putting an action plan into place with treatment of various sorts. We don't really feel like we're bound to a certain type of treatment because we're not in the traditional or conventional medicine model. And then by the third visit, we're following up to see if our treatment plan is working. Do we need to do additional testing? And we're looking for the best results we can to get people to where they feel like they're thriving. With the MaxWell CARE program, we are seeing all sorts of different types of patients. We're seeing everything from people who already know quite a bit about their own health, have delved into the world of holistic and functional medicine, and they're just wanting to delve a little bit further into their own health. And then on the other end, we see quite a few patients who have been all over the place. They've gone through the conventional medicine the whole system, and a lot of them have even gone outside of conventional medicine seeking help and haven't been getting the answers that they want. And so we sometimes are, in a way, a last resort for those types of patients, and then everything in between. We are not limited as far as our scope of practice, what we see. So really, it's the whole gamut of healthcare. And so we have a lot of resources here, and when we don't have the resources, say we need a surgeon to see you or a specialist to see you, we have those people that we can refer you to and bring it all together. The MaxWell CARE program is different than a traditional model in that it's very individualized. We're really looking for the root cause of our patients' problems and then going after them in a different way. It does tend to take longer as far as for people to feel the effects, because we are going after the root cause and we're not just putting Band-Aids on symptoms. The MaxWell CARE program offers two different options. The first one is a 90-day option, and the second one is a 12-month program. And the 90-day option is more for people who are already pretty healthy, know quite a bit about their own health, and they may have a couple of problems that they want to work on that aren't real serious. So that's really the minority of the patients that we see here at Maxwell Clinic. The 12-month program, you have a lot more time to start working on the issues that you have. It's more for the more complex patients, but that's the majority of what we see here. So I would say that probably 90+% of the patients that we see are more appropriate for the 12-month program, because we need time to delve in, to see how the treatments are working, and to get you to where you want to be in your health. For the 90-day program, I would say that the more minor symptoms, like say somebody's having just some minor gut issues, or they're having just some problems with, like, just say some minor heart palpitations or something like that, those are more appropriate for a 90-day program. We need more time to delve into issues when they're more serious, and so we recommend the 12-month program for those patients. Integrating the conventional and functional medicine approach is something that is definitely done here at MaxWell Clinic, because all of us have been trained in the conventional medicine model, and we've also been trained and had experience in the functional medicine model. And so there are times when we are still using traditional medications, prescription medications, because they're appropriate. They do get to the root cause of the problem, and so we use those types of things. I'd say the majority of what we do is probably non-traditional. We're using more supplements. We're using non-traditional treatments like neurofeedback or plasma exchange or light therapy. Those therapies get to the roots of the problem, and they tend to have less side effects, which is really, we're trying to do the most benefit with doing no harm. So that's kind of our approach here at MaxWell Clinic. When dealing with chronic conditions, the conventional medicine model is more of a, let's look at your symptoms and how do we decrease your symptoms. And I really feel it's more of a Band-Aid model, which unfortunately I practiced in for about 20 years. And it just got less and less fulfilling for me. Whereas the model that we're using in chronic disease, we're looking at the patient holistically, we're looking at root cause, we're looking at how the history plays into that, and then we're going after that, trying to find what the underlying reason is for the issue. That takes more digging and it takes more time, but it's definitely worth it in the end, because the outcome in the end is not just that you feel better, but the outcome in the end is that your health has changed. Whereas in the conventional model, the health hasn't necessarily changed. We're looking to make you healthier from a root cause. So using more advanced diagnostics, that is something that's very different from a conventional model. We're using tests that are not used in the conventional medicine world. We're using test kits that look more deeply into the true physiology of what's going on in your body, and how those things interact with each other. It's a pretty we are very complex as humans, and our health is very complex. And so I'd say we're delving more into the true biochemistry of what's going on in your body. And we have a lot of different tools, whether it's genetics, whether it's looking at your gut at a more deep level, because the gut really affects so much of your health. We have advanced testing for the brain, and so it's been fun for me to work with those advanced diagnostic tests to be able to really get to the root of the problem. I want to share just a little bit about a couple of patients that I've seen recently who have just done fantastic. I have a middle-aged woman who came in to see me, and we've probably been working together for about 6 to 8 months, and she struggles with her weight. Her sugar levels were on the high side, kind of moving towards diabetes. She was just not feeling good, feeling fatigued, and a lot of what we did with her was just the basics. We took a look at her entire history. We looked at her basic labs, which are a little bit more extensive than in conventional medicine, but we're able to help direct her, especially in lifestyle. We have a dietitian who's on staff here, which is super helpful for somebody like her. and put her on a few supplements, and it was amazing how in just a few months she was feeling like a completely different person. Her weight had dropped and her energy was pretty much back to normal, and I think she said, I haven't felt this good in 20 years or more. And those kind of stories are just really fun to be a part of. Had another patient who came to us for plasma exchange. He was having problems with his memory, had probably moderate dementia, and we started plasma exchange with him. And it was fun to be able to talk to both him and his significant other, who had noticed that the patient was starting to do things that they weren't able to do before. They were able to recover some of those things that were lost. They were able to remember why they went into the room that they went into. Just some of those basic things that we take for granted. And it's fun to be able to see people's brains start to function better again. We involve patients in really every process that we do here. We want to make sure that the patients are involved in the decision making, whether it's a lifestyle issue, changing their diet, changing their exercise routine. And then also when it comes to especially big changes in their health care, whether it's advising them with a new therapy that we're wanting them to do because we think it's the best way. We want to make sure that they understand why we're doing that. We want to make sure that the patients buy into what we're recommending, because otherwise they're not going to follow through. That's kind of just human nature. And so we want to make sure that we explain why we're doing what we're doing. Lifestyle changes in the MaxWell CARE program are incredibly important. I found that people changing the way they eat, and it changes their health tremendously. I would say probably the biggest change that people can make for the most part. I mean, it's not the case in everybody's situation, but that changes things so much. We're looking at stress, we're looking at movement and exercise, we're looking at relationships, we're looking at spirituality, and so those are all lifestyle things that we delve into, and those are so important, and it's a much more holistic approach to patient care, and it makes a difference. We do see a lot of complex cases here at MaxWell Clinic, and I guess it's just dealing with, first of all, testing. After we get done with getting the history, which usually is extensive in these patients, and it takes a long time, and we want to take the time to get that history, but there usually is quite a bit more testing when it comes to more complex patients. We have a wide variety of tests that we can do that dig a lot deeper into the biochemistry of what's happening in the body. Once we have those tests, then it's a matter of coming up with a treatment plan that makes sense based on the tests. And sometimes we have to do, a battery of tests, and then that brings up some more questions that we have, and so we have to dig deeper and do some more testing. We have to sometimes try out a particular treatment which made sense as a result of the testing that we do, and then sometimes we have to modify that. We have to shift. Not everything is going to be the panacea, and sometimes it's a variety of different modalities that we're using. That's really the case with most patients. It's not like there's one thing that's going to make all the difference. We're using a multitude of modalities to help that patient get beyond those chronic conditions that have been plaguing them for a long time. So we have a variety of different parts of the MaxWell CARE program that support the patient. I mean, first of all, you have your clinician, who's going to be kind of the quarterback but we have a lot of other people who are involved in your care. So we have the patient advocates who are checking in on you between visits. They're also talking to you after your visit to make sure that you understand everything that the clinician has recommended. We have our medical assistants who are checking you out after your visit, making sure that you have all the things that you need, whether it's a test kit, whether it's your supplements, all those things. There's a lot of detail into what we do here, and because of that, we need more support. You always have access to your clinician or other people on your team as far as through our portal. So you can message us through the portal and you'll get to the appropriate person who can answer your question. So we have a dietitian here that is going to be supporting you in your health as far as preparing a plan that makes sense for you specifically and how to eat. So there's a lot of different ways that we're helping to support our patients. So you're not feeling like you're alone, you've got a lot of support, and if we don't have the answer, we will find the answer. Measuring progress and success with the MaxWell CARE program, it varies obviously depending on the patient, but a lot of it has to do with, first of all, are you feeling better? Are you getting to your goals that you came with to MaxWell CARE? And also we're looking at testing. So we're testing initially and then we're going to retest to make sure that things are moving in the right direction. If you're considering joining the MaxWell CARE program, I would say don't wait. Your health is important, and it's easy for us to procrastinate on things, and for some reason it's easy for us to procrastinate about our health. Your health is your ticket to a better life, and we want to see you reach the goals that you have. We want to see you thrive. And so we want to have you come see us here at MaxWell Clinic and help you to help yourself in making a better life and feeling as good as you can so that you can enjoy your life and be as productive as possible.